So if it goes inside of a cell, then it's already into a chronic disease. And that can't be, it's not in a, normally if you think of a chronic disease, that means they've had it a long time. A person can have Borrelia bacteria, a Lyme infection, and have it go into a spirochete inside the cell phase actually within a matter of hours. Normally the window is about, you say about 2 weeks to 60 days on most people. That means if I got bit by a tick and I got this rash and I found the tick on me and I have a fever and I go into the doctor, I typically have about 2 weeks to 60 days, pushing it at the far end, that taking an antibiotic is actually going to kill this thing and it will never become chronic Lyme. That was me twice in my life. So the first time was back 20 years ago, oh gosh, longer than that probably, I don't remember, that I got bit by a tick. I had a bullseye reaction. It was, if I would have had a digital camera at that time, it would have been textbook, floating around the internet right now, because it literally looked like it took red lipstick and drew a bullseye on my stomach, right there. Went to the doctor to get an antibiotic immediately, and he said no. So I had a friend that was an MD that wrote the prescription that understood chronic Lyme, and he gave me a prescription, knocked it out of me. I never take antibiotics, never take any drugs, so it just worked for me just like that, knocked it out of me, and about literally within 2 hours all my symptoms went away. So I was very fortunate to catch it and to know what I know. But what I knew then was nothing compared to what I know now about Lyme disease. Second time was just 2 years ago. Never, I wasn't even outside. I actually went outside, walked around a person's house to do some grounding of their house. Actually was dressed like something like this and didn't have any tick bite, didn't have any noticeable idea that I had any sort of infection whatsoever. But I went in and talked to the people, they're patients of mine. He was a cancer patient of mine. Talked to him for about 15 minutes in the house. They had this cute little puppy that would not leave me alone, and I was having fun petting this puppy. It took me about a week to figure out that what I had was Lyme. I thought I had food poisoning, because I get a violent reaction with Lyme. I get super sick. I missed, I think, 2 days of work. I never miss work. So I was deathly sick. It didn't even dawn on me that I had Lyme disease. So it was in March, I think, and I hadn't even been outside at all. I thought, what, how can I get, oh, what's that? Dog! Sure enough, that's what I had. Took some antibiotics, knocked it right out of me, and I haven't had an issue. So I have not been in this chronic infection stage. My daughter, on the other hand, is 31 years old, my oldest daughter. We used to live up in the woods, and she ended up with Lyme disease. Never had the acute infection, never had the bullseye rash, never was sick with the flu. I don't know, not that we remember. Started getting joint swelling all over. We were doing a lot of work out in the woods. Of course, I thought she was just being a baby. Get to work, come on, I'm your dad. No, she had Lyme disease, chronic Lyme, so I felt like a horrible parent. Now we figured it out. Antibiotics did not work with her, and we came up with a herbal remedy for her, and she's in the chronic Lyme phase that we're going to talk about at depth here, that herbals work for her. So somebody like my daughter Jessie, who is in the chronic Lyme phase, she has very little symptoms. Maybe once a year she'll call me and say, Dad, my Lyme's flared up, my knee's all swollen up, or something like that. And she travels for a living, teaches seminars around the country on real estate, and she will call me in from Pittsburgh or something, and I'll say, go find this is what you need to get, blah, 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 because she's in the chronic stage. She's not in the third phase. Now, most people that are very debilitated from Lyme disease are not in what I term the chronic stage. They are actually in an autoimmune stage that we're going to talk about in just a couple minutes. Still with me? So you have the acute infection that's curable by antibiotics. And I think it's truly curable on many people if you catch it at a time when the bacteria is circulating in the bloodstream and has not yet gone intracellular. Antibiotics will kill it. Borrelia is a gram-negative bacteria, similar to some other gram-negative bacteria, that unfortunately have the ability to go inside of a cell and hide inside the cell and disable that marker. Remember I said when a cell is infiltrated by a pathogen, it gives off this little marker, this little protein marker on the outside of the cell membrane telling the immune system that it's been infiltrated and the immune system destroys the cell. There's several bacteria, Lyme, Borrelia being one of them, H. pylori being another one, that has the ability to go intracellular and disable that marker. So the immune system doesn't know that the bacteria is hiding inside the cell. It can reproduce inside the cell, disrupt cellular function, thereby making you ill. It's an opportunistic organism, so when the opportunity arises that there is less macrophages and white blood cells and Th1 cytokines circulating in the spaces between the cells, it goes outside of the cell and it starts reproducing outside of the cell and hides in other cells, and it just makes you sick. And your immune system is unable to kill it. Now you can stay in that phase. And if you have a healthy enough immune system, you can stay in this phase and you can have just little Lyme outbreaks, you know, every period of time or whatever, like my daughter, about once a year, maybe sometimes twice a year. Sometimes she'll go more than a year before she has some little thing that she recognizes as an outbreak. Now she may have other symptoms that she doesn't necessarily recognize as a Lyme outbreak, but she recognizes joint issues with her symptoms. And that is a person that's in a chronic Lyme state, but it's very manageable, typically with things that will help stimulate an immune system function, a healthier immune system.